Hello guys, welcome to my community. It's nice to be here on again to talk about my life in the UK. Guys, my name is Jane Sampson. My face for the very first time. Hello, nice to meet you. If you're returning subscribers, you guys are the real guys. Nice to be on here again today to talk about how you can relocate to the UK as a healthcare worker. So guys, on this channel, we talk about everything that has to do with relocating to the UK as a healthcare worker, as a student living abroad. I recently relocated to the UK as a healthcare worker, and on this channel, I share my experience and on my journey on how I successfully relocated to the UK as a healthcare worker. If it's something you're interested in, why don't you just go ahead and subscribe onto this channel, click the like button, share, and also hit your notification, the bell icon on the right. That will notify you each time I post a video. Guys, I have so much coming on this channel. It's been very tight on my hands. It's not been very easy. I'm trying to combine work, but I'm trying my best. So please bear with me. But each time a video comes up, trust me, it's going to be very loaded. Now guys, I've had loads of emails, comments, people that want to contact me. I'm very sorry if I've not been able to respond to your email individually. It's not been easy. It is actually tough, right? But due to popular demand, I am now going to be having a one-on-one section. I really have to, squeeze out time to have a one-on-one section. So I'm going to create a calendar where you can book and have a one-on-one session with me to ask your questions on how I did my own process successfully. So I'll be sharing from my experience, from other people that I've met so far, and how you can also do it on your own. So I'll be having a one-on-one session, and I'll be having the link in the description so you can book a one-on-one section. Please, this is a big disclaimer. I am not an immigration consultant. I do not give care jobs. I do not have affiliation with any care home. Everything I'll be sharing is from my own experience, right guys? So please, let's have this at the back of our mind that I just give my own experience. I'll be guiding you how I did this, sharing my own experience. You can ask me your personal questions, your fears, whatever it is you want to ask. You can now book a one-on-one session with me. Right guys, who is excited? Woo! I'm excited to be able to connect with you guys one-on-one. So right, let's dive into this video. This video, I still have people that are asking in the comment section, what document do we need? What do we need to apply? What do we need? This, that. So I'll be breaking it down and bringing to you the different document that you will need for you to apply at the different stages. So if it's something you're interested in, stay to the end so that you don't miss any gist. Right, so guys, the first thing that you need is your care experience. You need experience in care for you to be able to convince your employer that you can provide care. I know some employers or some people will say, oh, you don't need any experience, but the truth is, having experience gives you an edge, even though the job is what anybody can do, but you need some level of experience in providing care. And some people have been asking me, oh, how do I go about getting experience? Go to any hospital, go to any clinic, and tell them you want to volunteer for at least a period of 3 to 6 months. A period of 3 to 6 months is great for you to have all the experience of providing care in a hospital setting. This is my advice, all right? So when you show an employer that you have worked in a hospital setting, they know that of a truth you can provide any kind of care to any kind of people. So whether they put you in a care home, whether you're providing domiciliary care, whether you're providing support, or whether you're working in a hospital, that gives you enough leverage. This is my advice, all right guys? So go ahead and get healthcare experience, and at the end of the day, make sure that the employer or whoever you're volunteering for will be giving you reference. This is really important. Let them know from the beginning that I'm providing you reference at the end of the day to cover the description of the job that you have been doing or you've been volunteering for. All right, that's number one. Now, number two, you need care training certificate. Now, people go online, they're different. If you go online, there are free certificates, there are free online training. But what you need for care training is what we call the care certificate. Now, the care certificate makes up about 15 standard modules of different training in care. With that different training in care, it covers what the NHS or what the healthcare system in the UK feels that is the basis for you to have to be able to provide care. It's called the care certificate. It's about 15 different trainings. So it goes from infection control, safeguarding of vulnerable adults. It's about 15 of them. So that is what you need. That is almost what you need. If you have that, every other additional online training you have in healthcare is a plus. But what you need basically is care certificate and some online platform which I've listed in my previous video. They provide this care certificate. Some are free, some you just pay a little token to have this care certificate. That's number 2. Now, number 3, another thing that you also need is your proof of English. Now, the UK desire that we from some African countries or from some other countries, we need to prove that we can communicate effectively in English. And there are different ways you can prove it. You can prove this by writing IELTS, IELTS, or by having a NARIC certificate. NARIC certificate is that if you went to an English-speaking university, you can use a certificate. You can now evaluate it on the NARIC platform to say, okay, I'm evaluating my certificate that I went to school in English and I don't need IELTS. You need to pay for that as well. I'll drop the link in the description. Or if you went to school, in an English-speaking country, you can prove. For me, I went to school in an English-speaking, like in England, I didn't need IELTS. So I just went ahead and I provided my transcript and I was able to use that as a proof of English. So really, really important. You need either IELTS or NARIC, or if you went to school in a recognized English-speaking country, then you can get your transcript and present to them as a proof of English. All right? That's number 3. My next one and the next document that is really, really important that you need is criminal record certificate. Now, the UK take criminal record conviction very, very seriously. Almost every job you apply for, they will ask you if you have criminal record, if you have unspent or spent records. It's not like they're using that to deny you, but they just want to know, because you're working with clients, you're working with vulnerable adults, you're working with vulnerable children, so they want to know your history. So it is something that's really important to them. So you need to provide from your country or any other country that you have lived in the last 10 years, your criminal record. So for example, wherever country you are right now, you need to provide a criminal record from there. Whatever country you lived in the past years, you need to, the last 10 years, you need to provide a criminal record from that country. Really, really important. If you're from Nigeria, we call it the police certificate. They can call it whatever it is from your own country, but I think most times this is gotten from the police, where they give you a record to show that you are free from any criminal conviction. All right, here in the UK they call it the DBS, to show that you don't have any criminal conviction, to show that you don't have any criminal charges against you. This is really, really important. Okay, now the next document that is really important, and most people have been going up about it, is the driving license. Now, a lot of care jobs I have seen that are recruiting from abroad are usually domiciliary care. Domiciliary care, I've explained in my previous video, is the care that you go to the clients, you drive to their houses one after the other to provide care in their own homes. It is called domiciliary care, or it is called home care. All right, so most employers, they decide you need to have a driving license. Just recently, I heard that some people, they instead of driving, they use bicycle. I also heard that some people walk. They walk from one client's house to another. Depends on the proximity of the clients of their homes. Okay, so for you to be able to get one of the job, it is essential that you have a driving license. There's this controversy that people say, oh, you can use your national driving license, you can use international driving license. Well, for me, I got my international driving license, which I think is safe. It's just safe for you to do. It doesn't cost much. It doesn't cost much. So why don't you just go ahead and get your international driving license? This is valid for 1 year. After 1 year, you are expected to now learn how to, go through the driving school in the UK, and then get your driving certificate here in the UK. To be on the safe side, my best advice is to get the international driving license. All right. That's another thing most employers really do. And while you're getting international driving license, ensure you know how to drive. Guys, don't go and get international driving license and you cannot drive. You are just putting yourself in hot soup. Ensure you know how to drive car, and if possible, know how to drive manual cars. It was when I got here I realized that the UK have more manual cars than automatic. Yes, all right. Okay, another document that is really, really important, guys, is your COVID vaccination. Most employers require that you are vaccinated against COVID. Even though currently the UK, the COVID and whatever is being relaxed, if people are going about their normal business, you don't even need to wear masks so much. But we carers, when we go into our clients, we see cover up and we mask up. And most employers require that you are vaccinated against COVID. When I mean vaccinated, full vaccination. So why don't you go ahead and vaccinate yourself, so that by the time you're applying for this job, you're letting the employer know that I have all my documents ready. Like I keep saying, when you have your documents ready, it makes the process easier. All right. So that's the next document. Another thing that you also need is, while you are applying for this job, guys, you need to apply for the job that have minimum salary band of £20,480. Okay, that's the minimum. So any job that is between 18,000 19,000 pounds does not qualify you, because you need about 70 points for you to be able to apply for this visa. And one of the requirements is applying for the jobs that can pay you up to 20,480 pounds. That's the minimum, or £10, 10p per hour. That's the minimum. So when you see jobs that are below 20,000 pounds, don't bother. They cannot even sponsor you in the first place. Okay, the minimum requirement, that's the salary band. That is another requirement. All right. And also it has to be another thing, that it has to be on the shortage occupation list. So it has to be under the senior carer, or it has to be the home carer, it has to be the care. I'll be putting the list in the description of all the documents, the direct link, so you go there and see these things for yourself. Every information you need is on the UK website. I'm just listing them here. All right, guys, at this point, if you have not subscribed, what are you waiting for? There's so much information that will be coming on this channel. It's in your best interest for you to subscribe, and don't miss out on the juice that will be coming on this channel. Right, so guys, I've talked about references. That's another important part of the documentation process while you are applying for your job application, or wherever you're training, or wherever you're working right now. Remember that the employer, they have to give you reference. It is very, very important. So have their correct contact details, their working emails, their correct contact address, and let them know that they'll be giving you reference. Okay, so that they'll be on the outlook, they'll be checking their email, they'll be checking their inbox when they eventually give you an interview, grant you an interview, and give you the job, that they'll be giving you reference. UK, they don't play with reference. They don't. So if you think it's a walkover, you must give reference, and it has to be reference that is verified. So that's how that's at the back of your mind, that whoever that is giving you reference should know that it is something that is really, really important. All right. So the next document that you need is your TB test, your tuberculosis test result. Now, the UK has listed some countries, a whole lot of them, that they feel that maybe they are prone to tuberculosis. So they want you to test yourself and ensure that you don't have tuberculosis. And funny enough, this test is not just done from any hospital. They have hospitals that are listed in every country that you have to go and take the test from. From when I did my research, I realized that some countries, in fact, you have to go to another country, for you to, I think Benin has to go to Ghana or so for them to do the test, all right? So, but in Nigeria, they have about 2 test centers that take in Lagos and in Abuja, and you have to book ahead of time. So if you're coming with your family, you're coming with your children, they have to go through the TB test as well. All this is also in the link I'll be dropping in the description. It's your proof of fund. This is really, really, this is what you need when you're about to apply for your visa anyway. You need a minimum of £1,270. Now, you need this if your company is not giving you maintenance. Now, by the time you get your certificate of sponsorship, which is what you get by the time you're successful in your interview, you get a unique number. That unique number will be on your visa. It will be on your biometric resident card. It's also what you need for you to apply. The UK, your company might be either providing maintenance for you. That maintenance will cover your accommodation or any other thing that they want to be providing for you. But if your company is not providing accommodation for you or maintenance, that means you have to prove to the Home Office that you can take care of yourself when you come into the UK. And the minimum amount they require for you, the main applicants, is £1,270. Every other amount that is required for your husband, your children, or whoever that is coming with you, it's going to be in the description. I'll be dropping below. So have this at the back of your mind. Guys, these are the important documents that you need for your application. All right, your care training, your care certificates, your police report, your references. These are your things that you need for you to start applying. Your experience is really, really important. Please, if you have any questions, go ahead and ask me in the comment section. I'll be very, very happy to answer your question. And also remember, like I said, you cannot have a one-on-one session with Moa. The link will be in the description. It's just for a little token. I'm not an immigration consultant. I'm just sharing from my own personal experience, and I'll be happy to share whatever questions you want to ask me. All right. So guys, by the time you provide all these documents and hopefully your interview becomes successful, what your employer will be providing for you is what we call the certificate of sponsorship. Now, what this is a unique reference number that will be given to. They will give you a form to fill to put your details. That form they will now use to apply to the Home Office to give you a certificate of sponsorship. It's a unique number that you will use in your visa application. It depends on you if you want to come with your family. It depends on you if you want to come alone. It all depends on you. But know that if you want to come with your family, it now involves more financial, implications. All right. So guys, this is really, really important. While at that, you also need your passports. So I know that right now there's a backlog, in my home country. Go ahead. If you've not gotten your passport, that's the first thing you actually need, your valid passport, to show that yes, you are ready for this journey. So guys, these are the basic documents that you actually need for this process. So go ahead, get the ones you can get. You can leave like the TB test, you can leave it for later on. Leave that one because it's quite expensive. Leave it for later on, but every other one, get them together, and then as you're applying, you let your potential employers know that you have all these documents ready and you are good to go. All right, if you have any questions, go ahead and ask me in the comment section. I'll be very, very happy to answer your question. And also remember, like I said, you cannot have a one-on-one session with Moa. The link will be in the description. It's just for a little token. I'm not an immigration consultant. I'm just sharing from my own personal experience, and I'll be happy to share whatever questions you want to ask me. All right, so guys, any questions you have, feel free, go ahead and ask me in the comment. I'll be happy to answer your questions. I hope you enjoyed this video. I hope you've gotten value from this. Look forward to my next video, and I'll see you guys pretty soon. Meanwhile, don't forget to subscribe. There is so much more coming on. Click on the bell icon to notify you when next I post the next video. For now, I'll be saying ciao. Take care, guys.